Welcome to Enlightened, the enlightened journey of life. I am your host, Jen Hamilton, and it is an honor to have you here. I am a conscious life coach and women's empowerment mentor, and I activate a potent level of self and soul inquiry with my clients, which initiates deep and lasting transformation in all areas of their lives. I am here for the full human experience, authentically and audaciously sharing my magic with the world. On this podcast, we're all about mastering life on the way to enlightenment. And as we are here having a human experience, we might as well embrace it all. We play in the space of what is real and tangible, just as much as we play in the space of esoteric and metaphysical. You'll be ignited by deep conversation, whether through my own personal musings, interviews with incredible thought leaders around the world, and everyday divine humans sharing their soulful stories. Thank you for being on this journey. Let's dive in. Hello and welcome to another episode of the Enlightened Podcast. I am your host, Jen, and today's very special guest is Dr. Carolina Sueldo, who is a double board certified physician as an OBGYN and fertility specialist. She is all about empowering women through education about their fertility and wants to empower women through reproductive enlightenment. In this episode, we dive into topics around egg freezing and fertility, and also touch on the taboo topic of abortion and the overturn of Roe v Wade in the United States. I'm so excited for this very special episode. So without further ado, let's dive in. Welcome, Dr. Caroline. Thank you so much for joining me. How are you?
I'm doing well, Jen. Thank you so much for having me on today. I'm really looking forward to the interview.
So am I. I've got a question for you. What inspired you to get out of bed this morning?
My kids. It wasn't so much inspiration. It was more, Mommy, it's 5:30. It's time to get up now.
I know the exact same
yeah.
feeling. If it's not the kids, it's the dog.
Yep, exactly. So that I usually like to sleep in when I can. And that has not happened for a long time now.
Yes, no, I know the feeling. Now you're in a beautiful part of the world, moving to another beautiful part of the world soon. So you are in Yosemite and you're moving
Yeah.
all the way over to Florida soon. What's taking you to Florida?
Yeah. So my husband's family, he's born and raised there. They're still all out there. And my family, my parents, thankfully, are willing to move. So we just decided it was time to get everybody together, especially now with the arrival of the second grandbaby. It's really all about family, right? In the end.
It is. I'd love to hear your journey into becoming an OBGYN and a fertility specialist. What is it that got you into this work?
Yeah, so my journey is a little bit different than most physicians. So I grew up in the States, but at the age of 15, moved to Argentina. And I lived in just outside the capital of Buenos Aires. And I ended up doing high school and then decided to stay for medical school there. So I did medical school in Buenos Aires, and then I came back to the States for my residency training. And when I was going into OBGYN, really there was this thought of, I'm sorry, let me preface, both my parents are physicians. My dad is a fertility specialist and my mom is a psychiatrist. And so when I was trying to navigate the decision of which, field to go into, my mom was very open, do what you love. This needs to be your passion. You're going to practice it for many years. And I really loved women's health. I loved the idea of empowering women through knowledge. At the time, it was more focused on things like birth control and sexually transmitted diseases and just really informing. First it started with just friends and family, and then obviously that grew. But I was hesitant because I didn't want to be known as the daughter of. I didn't want to be in the shadows of my father, and I really wanted to carve my own path. And and at the end of the day, I went into it because I genuinely loved it. When I was in my OBGYN training, about 6 or 7 months in, I did get exposure to the IVF lab. And for those that don't know, IVF stands for in vitro fertilization. And that is one of the assisted reproductive technologies that we do for patients who are trying to build their family and are having difficulty. So when I saw the lab and I saw what the embryologists are able to do, it really was mind blowing. I mean, I just was blown away by it. So I always say I went into it because of the science. I fell in love with it because of the patients. The relationship between a fertility doctor and and the patient is such a unique, such a personal, intimate relationship that I don't really think it compares to anything else in medicine. And so, it's a young field. You have to stay in the know. You have to stay up to date. You have to go to the meetings, read the studies. But really, for me, it's about the patients and the relationship with the patient. So, in a nutshell, that's kind of why I decided to do it.
That's incredible. And so how long have you been doing it for now?
So almost a decade now. I finished to do infertility here in the States, you do 4 years of OBGYN, and then you have to do 3 more years of an infertility fellowship, and then you have to become board certified in both. So I finished my fellowship in 2015, so almost a decade in practice. And so I became double board certified in both specialties.
Okay, beautiful. And I'm
Yeah.
really curious to dive down essentially the rabbit hole of infertility. What in your professional practice are you seeing? Like, let's talk statistics for a moment. Like, where
Sure.
are we at statistic wise in the US, or if you've got sort of worldwide statistics of infertility? What does that look like?
Yeah, so we know CDC actually has really good data from the sort of advent of IVF and infertility. It has been very highly regulated here in the United States. And so most clinics are reporting, how many patients, how many cycles, how many pregnancies, and those types of things. So we actually have really, really closely monitored data. And what the CDC states is that approximately 10 to 13% of US couples suffer from infertility. And the stat that I typically use is 1 in 8. So if you think about another really common disease, I always give the analogy of breast cancer. So breast cancer here in the States, we have a whole month dedicated to it where everybody goes pink. We have the Susan B. Komen race for the cure, and everyone wears pink ribbons. And the NFL, which is the National Football League here, they all wear their pink socks and pink laces and whatnot. And yet infertility is just as common. And I think that people don't really realize just how common it is, particularly post-industrial revolution, where we see, number one, women entering the workforce and women delaying their family building for their careers, and two, exposure to toxins that we never had been at any other time in our history. So there's really some major changes that occur in the 20th century that lead us to sort of all of this, now what we see today, which is infertility diagnoses becoming more and more common. I think the third point to make here too is that we're now actually talking about it, right? So it's probably more women are seeking out care and seeking out testing and treatment than before. And so there's probably a combination of all three of those things leading to the numbers that we see today.
Mm. What do you understand from, your perspective as to why it's now 1 in 8? I mean, obviously, you mentioned that, there's exposure to toxins, there's women delaying things because of going to work. Can you pinpoint anything that perhaps we're not seeing, perhaps it's not commonly known as to why we're like 1 in 8, like that's a pretty harsh number.
Yeah. So if you think about, and I always give, this story is if you think about your group of girlfriends, right? And you probably have a group of 8 or 10 girlfriends from school or that you maybe still stay in touch with. At least one of you has had trouble with infertility and has potentially sought out treatment, if not more. And we can't really pinpoint one singular thing. However, I will say the most important thing, or what we have found to be the most common thing, is advanced maternal age. So when you look at the numbers, just giving some background, and this is something I feel really strongly about, women need to understand that the biological clock is real. And so when we see that, women are now maybe beginning their families at 35, 37, 40. We have to understand that the biology does not accompany that. And so we know that women are born with all the eggs they're going to have in their lifetime, and they lose those eggs progressively and continually as they age. So until about age 35, we see that the number of eggs that women have and the quality or the health of those eggs remains fairly stable. And we see that both by testing for egg quantity, and we see that in the pregnancy outcomes for egg quality. So, chance of pregnancy, risk of miscarriage, risk of, chromosomal issues like Down syndrome, for example. What we see above the age of 35, though, is that between 35 and 40, there is a very slow, very real decline in fertility. And we see that both in the number of eggs that we're working with and the quality or the health of the eggs that we're working with. Now, that's not to say that women over 35 can't get pregnant. That's not to say that women over 40 can't get pregnant. By no means is that the message. But we do have to understand that there is this natural decline that's occurring. And this decline becomes much more acute above the age of 40. So we know that fertility is going to be much more difficult for women who are in those two age groups.
Mm. And where are things at with egg freezing? Are you finding that women are coming in earlier on to freeze their eggs to preserve the health and well-being of that younger egg so that therefore they can have them implanted again when they're maybe ready to a little bit later in their late 30s, early 40s?
So, Jen, I'm not seeing it as much as I would like. I'll say that.
Mm.
So, a little bit of backstory with regards to egg freezing. ASRM, which is the American Society of Reproductive Medicine, deemed egg freezing non-experimental in 2012. So, this is a technique that has been considered standard of care for approximately 10 years or so. And the reason for that is because of the freezing techniques in the lab. So the techniques that we use now, it's something called vitrification. The eggs are able to survive much better when we freeze and unfreeze them versus what they were able to in the past. So with a survival rate of now 80 to 85%, sometimes higher, it becomes a reasonable treatment option for women wanting to preserve their fertility. Now, historically, this was used for women who, for example, had a diagnosis of cancer and were going to be undergoing chemotherapy or radiation. But as the technique became more widely used and with the lab techniques more modernized and up to date with better survivability, there now became this option of elective egg freezing or social egg freezing for women who potentially knew that they were not going to be starting a family in their younger years and wanted to have some sort of alternative or insurance policy, if you will. And so egg freezing really comes about really in the last sort of 7 to 10 years. Unfortunately, I don't think we're seeing enough of it. Part of that, I think, is related to knowledge and information and women knowing that this is an option for them. This is part of my mission, why I'm here today and why I'm online and in, the different social channels. I think it's so important for women to understand what their options are, whether or not they choose to proceed with it. And I think the second part of it, frankly, comes down to cost. Egg freezing, at least here in the US, is not typically covered by insurance and can be quite costly in the sort of $8,000 to $10,000, $15,000 range in some cases. And so, for a woman who's maybe just starting her career or just finished school, that may not be a reasonable, cost expense for her. I think the counter argument to be made there is that, okay, ideally it should be covered. And that's something that I think many of us fertility specialists are working towards. But even in the setting that it's not covered, if these women know from the time they finish university that this is something they may want to do by age 30 or 32, sometime before the age of 35, then this is something that they can financially plan for, just like they would plan for a vacation or a down payment on a house. This would be one more thing to sort of add to that financial planning.
Yes, I love that you mentioned that. And just for anyone listening in Australia, I have done some research. So you are able to claim back egg freezing through your private health. Now, obviously, check your level of cover with that. Remembering that there is a 12-month waiting period on a new policy. So if you are thinking about doing it, 12 months down the track, now would be the time to start looking into that. As far as Medicare goes, which is essentially our free or subsidized medical assistance program here in Australia, for egg freezing, if a person has a condition that affects their fertility, like severe endometriosis or cancer that requires chemotherapy, Medicare will cover about half. In 2020, according to Monash IVF, egg freezing is $5,000 plus medication and hospital charges of about $3,000 to $4,000. So please just remember, though, that is a ballpark figure. That was correct, February of 2023. It might change, and always obviously, seek guidance either through your healthcare professional and your provider. But it's good to know, isn't it? Like, we're very, very blessed with our healthcare system here in Australia, that we have, subsidies on these things. And, whether it is, a dire situation, if someone does have, a condition like I mentioned, whether it's cancer and they're undergoing chemotherapy, or endometriosis, they have that option to do that. And, to be
Absolutely.
really honest with you, Dr. Carolina, um, I've not really heard of it in my field. It's always just been like, I mean, I fell pregnant at 27,
Hmm.
and I was sort of, in that healthy range. It wasn't really an option because, I mean, with my first pregnancy, I wasn't trying. I'd just come off the pill, and I'd
Hmm.
been on and off the pill for about 14 years.
Hmm.
And I didn't even have a period, and I fell pregnant as soon as I came off it. And unfortunately, that ended up being an ectopic pregnancy.
Mm.
But then I was able to fall pregnant on my following cycle, which was, very lucky, and, went on to have, a healthy pregnancy, and then another one a couple of years later. And so it never even crossed my mind that, I'd have to be freezing eggs. I was in, a relationship at the time. We were, quite settled, and, wanting to have children. So it's not something that we ever had to come across. But now, knowing people, very close to me who are having to undergo, different IVF treatments, and, just sort of, different ways in which to have babies. It never really crossed my mind because it wasn't in the forefront. And I think it's amazing that we get to have these conversations,
Yeah.
that we get to bring into awareness. Like, this statistic of 1 in 8 has blown my mind. Like, if I
Yeah.
think about my group of girlfriends, like, I've got more than 8 girlfriends, I've
Right.
got probably double that close to me. And it's like, essentially two of those in the
Hmm.
group, may go through this experience. And I think we need to make some noise about this. Not only make some noise about, obviously the reasons why we egg freeze, but let's talk about lifestyle, because lifestyle is such a big component in, well, anything to do with health and life. From your perspective as a medical professional, what is it that you're noticing about, let's talk about women first,
Sure.
women's health, because if we're
Sure.
talking about, preserving eggs and the health of eggs, we're going to talk about women's lifestyles. What is it that you're noticing, that perhaps women, is it the stress, is it the food, is it the lack of or more of something in particular?
Sure. So I think, the first comment or the first message for the audience is that reproductive health is health. So if you are not generally healthy, then your reproductive health is going to be impacted. And that it just falls in line with our biology, because the body sort of goes into, survival mode or inflammation mode. When you look at the stats here in the US, I mean, there's some studies reporting up to a third of US adults being obese classified by a body mass index over 30. We really see that weight plays a huge role in fertility. Now, that can go both ways. If you are extremely underweight, that can also impact. There's a lot of really good studies, particularly in women with eating disorders, anorexia, bulimia, etc., the impact that can have. But if you are underweight or significantly overweight, both of those are going to impact fertility. They do it in different ways. So with obesity, we know that there at least one mechanism is that the fatty tissue has an enzyme called aromatase. And not to get too medical here, but that aromatase enzyme basically makes estrogen. And so if the brain and the ovary need to have regular communication, a conversation like you and I are having today, that fatty tissue is basically a conference room full of people chattering, that are interfering with the normal communication between the brain and the ovary. And so it can definitely alter ovulation cycles. There's also a huge impact, and they're looking a lot into, our hormone balance with sleep. So people who are night shift workers tend to have more irregular cycles, tend to have more problems with fertility. And it's not just night shift workers. We see that people who have sleep disorders, sleep apnea, insomnia, things like that, we've actually seen impact fertility as well. And then I think, there are some substances that are common sense, things like tobacco, things like alcohol. And I will say, and you can share maybe the perspective from Australia, but here in the US, alcohol is so pervasive in our culture. It's very, very normalized. And most social gatherings, most social functions, alcohol is incorporated. Typically processed yummy foods are also incorporated. And so if that is, something that's normal for you, then making those adjustments is going to be a significant change to your lifestyle. And yet we know that those are significantly important for fertility. So when I'm counseling patients about the treatment plan for fertility, lifestyle is the number one thing that we start talking about. Where can optimization be made? Where can we improve things with your nutrition, with your, liquid intake? Are you someone who likes a lot of juices, or, et cetera? And so really trying to hone in on what is the day to day. You mentioned stress, and I think this is a great side note that I want to make. Maybe not a side note, maybe more like a tangent. We'll go down for just a minute.
Go
Um,
there.
but we see in this sort of modern day world that most humans are living with these sort of baseline chronic levels of sort of elevated stress in their body. And it's not a stress of like, oh, I'm going to die, right? It's not this like acute traumatic thing, but it's this slow, almost like a slow burn. It's almost like this just daily small incremental doses of chronic stress that is impacting not only, mental well-being, but also the body, right? So when a body is exposed to chronic daily inflammation, chronic daily stress, there is going to be long-term impacts to that. And even though we are the most technologically advanced that we've ever been at any point in our history, we do find that these rates of chronic stress are at a higher point than any other time in our history. And not to get too far down this rabbit hole, but looking at rates of anxiety, depression, panic attacks, things like that, particularly in this COVID, post-COVID world, we see them at rates that we never have before at any point in human history. And so we know that all of those things are going to be playing into our reproductive health and the body's ability to function the way that it needs to.
I love that. From obviously, you're in the medical field. From a medical perspective, what is happening to the people that are experiencing, stress, depression, and anxiety? Are they being medicated, or are they actually being spoken to about lifestyle and the ways in which, things can be controlled, through awareness? Like personally, as a coach, like I teach people awareness. I teach people how anxiety comes about and then the things that they can do. But in the medical field, which is very different to how I operate in my profession, is it just medicated? Is that just sort of, are we load stacking pharmacology?
Yeah, and I would say I think we're getting better. I think there was a tendency, particularly in Western medicine, to very much treat with something, right? So in the same way that you would treat high blood pressure with the pill, you treat diabetes with the pill. So now we're going to treat depression with a pill, anxiety with the pill, etc. I think now we understand it really needs to be a balance. There is absolutely a biological undertone that needs to be addressed medically. So I do wholeheartedly believe in the medications, but I think that that is one aspect to the treatment. And I think, we in Western medicine now talk a lot about multidisciplinary approaches. And so really, yes, working with a doctor for medication purposes will be very important, but also working on the mental health. So we talk about biopsychosocial, right? So what are the lifestyle or social pieces that can be optimized? What are the psychological or mental health pieces that can be optimized? And then what are the biological pieces that can be optimized?
Yeah, I love that. What about food? Does food play a role in it well, in reproductive health? Obviously it plays a part in lifestyle. I mean, 1 in 3 for obesity, like that statistic is mind-blowing as
Massive,
well.
right? Yeah.
What are we seeing as far as, food? Is it the trends of people, going on these fad diets perhaps? Like there's the keto, there's paleo, there's, high carb protein, all of the different things. Like, are we
It's a
just
buffet. Take your pick, right?
exactly right? Are we just, screwing up our systems completely by jumping on board the next best thing?
Sure, sure. So I will start by saying, you know, when you talk about nutrition and diet, the studies can get a little bit more gray because if you're not monitoring those patients exactly what they're intaking, if it's guidelines and then you're sort of relying on the study person to do it, it may or may not happen, right? But we do know something very real, and we know the processed foods are usually not good. Unprocessed foods are usually good. And so when I'm talking to patients about nutrition and lifestyle, I think number one, if you have struggled with nutrition your whole life, this is not something you can do alone. This is
Mm.
really something that requires accountability. And we know, and this is documented across medicine, that people who have attempted weight loss, diet modification, insert whatever lifestyle change, when you had accountability, the success rates were dramatically higher than when it was self reported change or self induced change. So, number one, I think accountability is huge. Number two is working with somebody who understands your condition or your disease. If you have been obese your whole life, you really need to work with a dietitian who is specialized in obesity. You need to work with a primary care provider. Now, I don't know, in Australia, here in the US, there's very trendy weight loss medications that are coming up. And yes, they may benefit, but you need to be working with someone who understands the medication, understands how it works in the body, its role, what are the potential risks to taking it, etc. And really focusing on, for example, a condition that I deal with often is PCOS, or a condition you mentioned earlier was endometriosis. If you're going to be focusing your nutrition to address these diseases, you really need to be working with somebody who understands about the disease. So it's going to be really individually tailored. I don't think that there's any studies showing that one diet is particularly superior to another, keto versus paleo versus, etc. I think the important things are tailoring to your condition if you have one. So, for example, we know that keto is actually not good for PCOS patients, or intermittent fasting is not good for PCOS patients, but it may benefit somebody else. And we know that working with someone who understands the condition is also important. So, accountability, tailoring for your diagnosis, and understanding that not one particular fad diet is superior to another, right? So it's which one can you be consistent with? Which one are you going to adhere to? That's going to be the one that's going to work for you.
Yeah, I love that. And so interesting, isn't it? Because I think, since the time of social media and more things being available on the internet and sponsored ads that we just see popping up all
Yes.
of the time, and influencers as well, plugging products, plugging supplements, with absolutely no idea of, any sort of a health background. I don't know about in the US, but I know that in Australia, general physicians, doctors, they don't have the nutritional training
Mm.
behind them. I
Mhm.
mean, they're incredible. Obviously,
Mhm.
absolutely, pharmaceuticals have a space where they're needed.
Mhm.
And they literally save lives, um, but that's generally what GPs do. What I find here in Australia is that, you go in with a particular condition, diet and lifestyle and even exercise is not even considered. And even
Mm.
For example, a few years ago when I went to see my father-in-law in the cancer ward, just all of the vending machines, they're all like all the sugar-free stuff. So all full of, aspartame and, all of the stuff. And then seeing the food that came around. And this was a public hospital. Even in the private though, like the food itself isn't,
Yep.
acknowledged for the nutritional content which is going to support the body. And I'm quite loud in this space. Like I'm such an advocate for nutrition because, and for me personally, it's intuitive nutrition. I'm not someone that, suffers from, PCOS or endometriosis, like that. I don't have any health conditions. I've got no heart conditions. So for me, it's like, okay, I get to eat intuitively. I know what my body needs. I know how my body thrives. I know how my body doesn't thrive because I've practiced that before too. Um,
Yeah.
but there, as you mentioned, there are different conditions out there, and it's really important to speak to someone that has got, clinical training in this space and understands nutrition from this perspective.
Yeah, and I will say from the medical side of things, I think we're just beginning to scratch the surface of this. I think we're just now starting to pay attention to the importance and the role that nutrition does ultimately have on overall health.
Yes, I absolutely starting to see it and celebrating it too, because, if we can infuse, medical and pharmaceutical with, you know, the complementary. I mean, it's so funny how we call it complementary, but, if we can infuse it with, the diet, the exercise,
Hmm.
nutrition, the well-being, the mental well-being of ourselves, so that we can understand that we can bring those stress levels down, that has such an impact on our bodies. The
Absolutely.
more that, for example, in Australia, we're just constantly seeing interest rate rises at the moment. So everyone's going into a heightened state of stress because everyone was buying houses through the pandemic when it was low interest rate. So now it's like, okay, I've got to scramble for more money. What do I have to do? I have to work more. I have
Hmm.
to work longer days. Well, if
Hmm.
I work longer days, I don't have the opportunity to be cooking home meals anymore. Let's just get something on the go. And I'm staying back at the office longer to get the next, pitch that I have to do. So therefore, I'm getting home later. I'm not sleeping properly. I'm not taking time to wind down. I'm feeling really stressed. I'm not spending time with my children. I'm on my phone more. And it just becomes this cycle, and we just get so wound up in the stress,
Hmm.
and we get so caught in just being in that, just that activating that sympathetic nervous system, that fight, flight, or
Hmm.
freeze,
Hmm.
which, as you would know, biologically we're designed to do that in the state of emergency. We're not meant to be hanging out there. And that's when we can start to see these detrimental effects on our body.
Hmm.
And the more we hang out there, the more we just get so tightly wound in there. And that's when we can experience a lot more anxiety. We can experience a lot more things happening in our body that are a cause of hanging out in this fear state. And it's a vicious cycle. And if
I
anything that
agree.
we've seen in the last 3 years is just how heightened that's been on a collective level as well. Everyone's experiencing it.
Yes.
Everyone's in it, scrambling for answers, going, what's going on? We're all like this, and it's just that, we pick up on that collective energy as well. It's like, oh, well, if the Smiths are doing it, the Jones are doing it, why aren't we doing it? And it's that, that desire for more, that ultimately at the end of the day, what I really feel is that desire for safety, and
Hmm.
if that
Hmm.
means a roof over our head for our children, because the interest rate rises are going up and the wages aren't, we're all looking outside of ourselves to, to just to make sure that we're safe, and we're seeing it so much. And then we're wondering why, we're looking at the statistics of 1 in 3 in obesity and 1 in 8 in infertility. And it's like, well, hang on, let's get right back to basics. What are we
Hmm.
looking at, within our lifestyle?
Hmm.
How are we sleeping? Are we meditating? Are we taking conscious effort to take time out and just breathe? And it's so good that it's now starting to be recognized in the medical profession as well, that lifestyle plays such a massive part in this. It's not just come in here, take this pill, off you go kind of thing. It's tell me about your lifestyle, what's going on for you.
And I love what I'm starting to see in the space, which is the integration of both, right? So before I felt like Western medicine would poo-poo anything that was complementary or alternative. And then vice versa, people that were in the alternative space were like, oh no, down with Western medicine, it's all poison. And now I really have begun to see this coming together from both spaces and saying, okay, we both add value, we both bring something to the table. Why don't we join forces and really provide the best care, right, overall for the patient? So I'm loving that shift in mindset that I'm seeing as well.
Yes, and even, even the doctors, the practitioners that are stepping out and offering both,
Mm-hmm.
offering
Mm-hmm.
integrative medicine, like that is amazing. Like there are
Yeah.
doctors, in Australia that I know that like they're practicing GPs, but they also offer acupuncture.
Yeah. That's
Like,
awesome.
this is amazing.
Yeah.
Like, if that is
Yeah.
the way the world is going, then that is amazing.
Yeah.
If we can start to say, "Hang on a second, can we take pieces from Western? Can we take pieces from Eastern? Can we
Exactly.
bring them together? Can we create unity for the sake of health, for the
Mm-hmm.
sake of wellness and
Mm-hmm.
longevity and well-being?" And ultimately, at the end of the day, it just means happiness.
Exactly.
Yeah, beautiful. Now you're at the moment, you're in the state of California, so we can speak about this.
Yeah.
Abortion.
Yeah.
And
Yeah. Let's
obviously
talk about it.
obviously it was, yeah, so last year, tell us a little bit about, the Roe and Wade overturn. What happened over there? Because 'Cause we're looking, from the outside world, obviously outside the medical field, but obviously over in Australia, we're looking to our friends in the US, like, what in all fuckery is going on over there?
Yeah,
Let's go
yeah.
there.
Many of us here said the same thing. No, so basically, I'll try to synthesize this as much as possible. But last June, the Supreme Court, which is the highest court here in the United States, made the determination that the verdict in Roe v. Wade had overstepped federal bounds, and so essentially overturned the verdict and returned to the states the autonomy to legislate abortion. So it's not that abortion was banned. It's not that, but it was just that as a nation at the federal level, there was now no sort of mandate or regulation on a federal level. And so now each state would be responsible for how it wanted to proceed regarding about abortion and reproductive rights. The issue, or what you see with that, is that in the United States, we have some states that are more pro abortion, or I shouldn't say pro abortion, pro choice, and pro sort of letting medical specialists decide with the patient what is in their best interest. And then you have more conservative states that believe that abortion should not be allowed either in any circumstances or only in very restrictive circumstances. And so those are what we call trigger bans. So immediately upon the overturning of Roe v. Wade last summer, we saw approximately a dozen states initiate these trigger bans where now abortion was either completely illegal or very restricted. And unfortunately, what the downstream consequences, right? Because it's not just about abortion, there's a lot of other things that fall under that umbrella. And the downstream consequences of that were now an impact to being able to treat women who were going through abnormal pregnancies. I had colleagues in the state of Texas who were not able to obtain medication, specifically called methotrexate, to treat an ectopic pregnancy, right? And so you see this whole downstream of effects from this decision. And I actually, here in the States, they like to use the terms pro-choice or pro-life. And as a fertility specialist that helps build families, I got a lot of pushback of like, well, how could you in any way support abortion? And I said, well, it's not that I support abortion, I support choice. I support that this needs to be a medical decision between the patient and her doctor, and there is no role for politics or government in this. That's what I support. And unfortunately, not only do we see these downstream effects, but now it becomes an access issue, right? Because the women who are needing a termination for whatever the reason and have the ability to cross state lines and seek treatment in states that are more favorable are going to do so. And so what you see is that the sort of lower socioeconomic classes, and particularly that ends up being minorities, end up being unfairly impacted by these decisions. From a reproductive health standpoint, and I stand behind ASRM, which is the American Society of Reproductive Medicine, and ACOG, the American College of OBGYNs. Usually those big organizations tend to be very sort of politically correct, and they try to not get involved. And both organizations really took a black and white stance on this and were very, very against the overturning of Roe v. Wade. And we are unfortunately still today fighting further legislation from being banned. And specific to a fertility specialist, not only do I see the early pregnancy care piece being impacted, but now we also see this impacting the way we practice IVF. So if life is considered at the time of fertilization, then an embryo, which is what we create when we're doing IVF, now cannot be discarded, now cannot be frozen, now cannot be genetically tested. And so you're not only impacting pregnancy care, which is bad enough in my opinion, but now you're also radically changing the way that IVF is practiced in that particular state. So we really have seen there's really, in my opinion, been no good that has come of this. And really we're seeing a lot of negative, unfortunately, still to this day, over 6 months later.
It's insane. You mentioned the Supreme Court.
Mm-hmm.
Who are these people? Like, is it just a bunch of old men with no
right.
fucking clue?
So the Supreme Court is composed of, judges that are appointed typically by the president and then have to be approved. They go through sort of an interview process, if you will, by the House of Congress. So what we saw, I believe, and don't quote me on this, but I believe it was during the Trump administration, there were court-appointed judges that tended to what's the right term to use here, to favor this sort of overturning of Roe v. Wade. And so we eventually saw that the majority of the Supreme Court justices leaned in that favor, and we eventually saw the overturning come.
Fucking hell.
Yeah.
It just, especially when it comes down to, IVF. I mean, come on. Yeah. I'm kind of speechless right now, which is hard for me.
It's really been tough. Again, as a women's healthcare advocate, as a fertility specialist, I always tell people, my couples, their pregnancies, those are some of the most desired pregnancies on the planet. And yet sometimes they still have to terminate for X reasons, right? And so it shouldn't matter what the reason is. All that should matter is that the decision is being made under the safety and safeguard of a medical physician. And so I think it's really unfortunate that it has become so politicized. And I have not been quiet about that. I think, unfortunately, it was interesting, and I won't stay too much longer on this topic, but I do feel strongly about it. They did a study and they saw that actually the majority of the US population did not really feel strongly about Roe v. Wade being overturned. And when they interviewed OBGYNs across the country, unanimously, or I shouldn't say unanimously, but the overwhelming majority were in support of keeping Roe v. Wade in place. And so, as someone who studied in Argentina, at the time that I studied, abortion was illegal. Now, since they have legalized it. But I had to see, what happens when people try to undergo illegal abortion, and really sort of the dangers that come along with that. So it's really an unfortunate thing that we're living over here.
It really is. And I mean, who decides? I mean, if it comes down to, a life situation, what about the life of the mother? Having personally gone through an ectopic pregnancy, mine got to the point where it ruptured and my life was in danger because it had ruptured. And obviously you find out through ultrasound that it had ruptured. I was literally at the doctor's surgery to get my blood test results of my pregnancy when I keeled over in pain, and we got rushed in an ambulance to the hospital, and they found it there. Had I not been able to essentially even have the test to diagnose the fact that it was ectopic and it ruptured. Like there was that much blood in my abdomen. There was about 1.5 liters of
Mm-hmm.
blood. They couldn't work out which tube had erupted,
Mm-hmm.
essentially. I mean, at what point do they say, oh, well, this mother's life is not worth it because there's an ectopic pregnancy, which essentially ectopic is not viable anyway. I mean, how do they determine that the mother's life should be at risk because of this law?
Yeah, and I think people forget, and we can talk about a few other cases in medicine where that's the case, such as era pre-vaccines, etc. But specifically with ectopic pregnancy, women used to die from that condition. That was the most number one cause for maternal mortality before we were able to diagnose it, before we were able to operate and save that mother's life and whatnot. And I think that people forget, we have short memories in terms of what that used to be like. Most of us grew up in a world where those are easily treatable. Vaccines are just a part of the pediatrician's visit, etc. And so I think it's important. And I think what you're going to see is an impact to maternal health. Again, I come back to miscarriages where there's a bleed or there's infection or an ectopic or whatnot. And I think, and without getting into too much of the weeds, each state, to answer your question, each state has come up with its own definition or its own restrictions in terms of, in the case of rape, in the case of incest, in the case of danger to the health of the mother, in the case of, if there's a heartbeat or no heartbeat or etc. So each state has its own regulations that providers are now having to navigate. I believe recently Virginia passed a complete abortion ban or something to that effect, where all abortion is considered illegal. And so it's really just, and I hate to say this, but unfortunately, when politicians become involved in healthcare decision making, this is what you see. And I do believe that you will see an increase in maternal mortality because of these decisions.
Mm. Is there any way of overturning it again? Like, is there enough noise? Like, are people protesting and rioting? Are all the, OBGYNs out there with posters and banners and storming parliament? Like, is that a thing? Can it be changed again, or are we done now?
So from a legal standpoint, I don't know what the implications are. I will tell you, we definitely would love to see it reversed, the decision reversed. I don't know if that's going to happen in the short term, certainly with the Supreme Court justices, remaining the same, typically for a number of years. What I can tell you is that some states have now, for example, California being one of them, has now put up to a vote, and it was passed here in November, that reproductive rights are protected within that state. So even if something were to happen at the federal level, at the state level, the reproductive right is being protected. And that's true for California and a few other states. So I don't know. I don't know how this is going to play out long term. I can hope. I can hope, but I don't know. Unless there's a dramatic change at the level of the Supreme Court, I'm not sure we're going to see any significant changes in the short-term future.
Well, high five, California.
Yeah.
Does that mean more women are then turning to egg freezing and going, well, I'll just put my eggs on ice until all this shit settles down, and I feel safe enough to go ahead with the pregnancy. I can't even believe I'm saying that in the year 2023.
I know.
But
I know. It's crazy.
is that where people are going?
I will tell you that it definitely has come up. For example, for patients who have embryos stored in those states, they say, well, I'm going to move my embryos to a more favorable state. And I think egg freezing, I think fertility treatment in general, I think people are looking more closely at that. I will say, there was a statistic at the end of last year that tubal ligations were up just some inordinate number from years past because women were coming in and requesting them, in numbers that we had not seen in a very, very long time. So what I think you see is more dramatic steps being taken. But again, it comes back to access, right? Not everyone can afford the cost of doing egg freezing. Not everyone can afford the cost of traveling to another state for their reproductive care. And so again, I think you're going to see that impact to maternal health. And unfortunately, the US is dead last when it comes to that. But when you talk about maternal health and maternal well-being, I think you're going to see a further impact to that.
Yeah. Yeah. It's very interesting times, isn't it? And look,
Mhm.
at the end of the day, we as women can hold intention. We can hold love for our sisters going through this, anywhere in the world. It is sad and it's disappointing that we're at this point, but we're here and we can't deny it. And what we can do is we can just support others, in the way that we can, and hold space for and hold intention that things start to change, and that, that
Exactly.
women get the best care that they possibly can in the state that they can. And,
And I
that they
think
can.
using your voice too, I think a lot of times we have this idea of like, well, it doesn't directly impact me, or it doesn't directly, I'm a fertility specialist. I'm practicing in California that was not, impacted. I, never had issues with fertility or the need for reproductive, termination or anything like that. But I would argue that that's not the point. The point is
Mm,
that all women should have that same experience. And so using your voice is just as important as somebody who's maybe in the trenches or seeing those things in the day to day.
100%. Let's get loud. I love activism, like I love, fighting, and, not necessarily fighting in a war way, but, fighting from a place of, fighting for the helpless, or the people
Mhm.
that don't have a voice, or that,
Mhm.
need the support around them because of this injustice.
Mhm.
And oh gosh, I could talk about this all day. Thank you so much for being, for just being so
Yeah.
open in this conversation, and just being able to speak, obviously legally about it, but, from your professional opinion as well. Now, you've got a YouTube channel, and
Yes. Yeah.
we will direct to that over in the show notes. Tell us about your YouTube channel. What can we find on there?
Yeah, so I started last spring. It was actually brought to my attention that something like 40% of Americans consume their healthcare information online. And so I said, okay, if that's where my patients are, then that's where I need to be. And so you'll find me on Instagram, you'll find me on Facebook, and you'll find my YouTube channel as well. All of them, it's just my name, Dr. Carolina Sueldo. And really, the big message there is information. I really talk about on my YouTube channel all things related to infertility. And they're really just short 10-minute clips because I have a short attention span. And so, really, just trying to give snippets of information that is vetted information from a healthcare professional. Of course, it's not medical advice, it's only for educational purposes, but it's really meant to empower women so that, if they're not getting the answers from their healthcare providers, that they have somewhere to turn to explore information about their fertility.
Beautiful, amazing. And before we wrap up, Dr. Carolina, have you got one piece of advice or wisdom that you would like to impart on our listeners?
Yeah, if I could say one takeaway thing is know your body. Know your
Mm,
body, know your options. I think as a fertility specialist, there's a perception of, well, she wants everyone to do egg freezing or she wants everyone to do IVF, and it could not be further from the truth. It really is about understanding the biological clock, understanding your body, understanding what's normal, what's not normal. And if you're not getting your questions answered, then let's go get them answered somewhere else. Really just being a self advocate, I think, is so powerful in today's healthcare space.
I love it. Thank you so much for joining me on this episode. You've been an absolute wealth of knowledge. And yeah, we can't wait to see you over on YouTube.
Thank you so much, Jen.
Thank you so much for joining me for this episode. I hope you love the Enlightened podcast, and the biggest compliment you can give me is subscribing to this podcast, sharing it, and leaving a rating and review. Feel free to follow me on Instagram. My handle is @JenHamiltonOfficial, and the podcast handle is Enlightened_podcast. You can also find the video version on YouTube on my channel. Just search Enlightened, and don't forget to hit subscribe. Have a beautiful day and enjoy living the enlightened journey of life.